Hi, welcome to Healthy Living. I'm Amy Bouton, Director of Communication and Marketing for St. Tammany Health System. So today I brought two special guests with me from the health system and from the St. Tammany Health Foundation to talk about World Autism Acceptance Month, but also to talk about an initiative that's happening and has been happening at St. Tammany Health System, and it's ongoing, to provide resources, education, and tools to parents and families of autistic children. So my first guest today is Sunny McDaniel. Sunny McDaniel is on the Board of Trustees for the St. Tammany Health Foundation. So welcome, Sunny.
Thank you. Thank you for having me.
Yeah, we're excited that you're here. We want to talk about our topic, right? World Autism Acceptance Month. But first I want you to tell people a little bit about you and your connection to the foundation.
So I started with the foundation 3 years ago. And when I joined the foundation, I knew my role was going to be starting the Autism Initiative at St. Tammany Health Systems. And there is a little bit background to that. I have 3 beautiful boys I'm very, very proud of, and a set of twins that are 11 and a 4-year-old. And one of my twins is autistic, and I knew very young, when he was very young, that he was. And so I knew in order to be able to advocate for him, not just personally but professionally, I needed to get more training and education. And so I enrolled into a graduate program at the University of North Dakota just in autism spectrum disorders. And that has helped advocate a lot for him, as well as my patients. And so what's happened with that is once we learned about autism as a family and we're growing, we realized that there's some missing links in the community. And one of those is in the healthcare system. And so when we started this Autism Initiative, what I've learned through my professional role in growing with my son, but also personal role, we've able to take it and implement it in other areas.
Okay, yeah, and this initiative, once we start talking about it, people's eyes will be open to how special
Sure.
it is, because it is amazing. And I tell people this all the time. I've told you this many times. It's the truth, what I'm saying. The first time I met you, I was blown away. Like within 15 minutes, I was like, okay, I kind of understand what
Yes.
autism is now.
Yeah.
You know, so I want you to share that perspective, and if you remember it, but I think you say it a lot to people because you want people to understand what autism is and
Yes.
how, you know, your child is a child who he needs a little bit of help, but he's just like every other child. So tell us
Correct.
about that.
So autism is a spectrum disorder, and it affects 1 in 36 children. But we need to make a note that a lot of times when we talk about autism, we're just talking about the pediatric population, and that's not the case. I just work in peds, so I tend this habit to talk about children. But the same philosophy goes into the adult world. So autism is a spectrum disorder. So Dr. Stephen Shore actually talks about this. He says if you know one child on the spectrum, you know one autistic kid. And it means that each of the core symptoms that make autism is unique to that individual only, okay? So what one autistic child might display as symptoms, a next one will look totally different. Mm-hmm. So what is it? Autism is a medical diagnosis, and that's important to point out because I'll come back to that in just a minute. But an autistic person will have challenges in 3 core areas. That is social communication, and that can be verbal or nonverbal. Mm-hmm. So a lot of times when you think about when we talk, a lot of times we speak, our message comes nonverbally. So I can say, oh, I really love that cake, and roll my eyes. We both know I didn't really like that cake.
Right.
I can be sad and still be happy. I can cry and still laugh, right? Mm-hmm. And so I watched this Stanford professor one time give a lecture, and it was very eye-opening, and it was about imitation wars. Have you ever seen that movie?
No.
So it's about Alan Turing, and Alan Turing was basically the father of computer science, and he was also a crypto analyst. And in this movie there is a scene, he's also known to be autistic, and in this scene he is basically he's with a government agency, and he's working away, and they're on this top, secret mission because they're trying to intercept the messages going over for our allies, right, to know where they're going to strike next. Mm-hmm. So in this scene, he's working away, and his buddies come on and say, "Alan, we're going to lunch." He doesn't respond. "Alan, we're going to lunch." Well, Mr. Turing doesn't respond at all. He keeps working. And they're like, "Alan, aren't you hungry?" And he's like, "Yes, I'd like a sandwich, please." Mm-hmm. And That was a perfect example, and that Stanford professor actually showed me that when I was listening to his lecture, because the invitation was actually this, right?
Yeah.
But he didn't respond until you asked him a question. So, Alan, we're going to lunch, doesn't require a statement. This was the invitation. So when you think that's kind of an example of the nonverbal component, all right? Eye contact and body language, I face you, I make eye contact. It's a cultural thing, but in our culture it says, I'm paying attention to you. So a lot of times people mistake that if I'm looking over to the side, I'm not facing you, and those things that I must not be paying attention at all, or I'm in my own world.
Yeah.
That is not the case. It's a sensory input of it. So the third core symptom is the presence of restrictive, repetitive behaviors, interests, or activities. And that's where you'll see, like, sometimes you'll get rigid thinking, you'll get struggles with transitions or flexibility, and the sensory components. And so when you look at that, it's kind of, I always give the example of driving down the road. You're driving down the road, you get lost. What's the first thing you do? You're going to turn down that radio.
Right.
The radio has nothing to do with you being lost. What you're doing is you're turning down that radio to decrease sensory input so I can focus.
You're tuning out.
Correct. Sometimes it's hard for individuals on the spectrum to be able to turn down that radio. So you can see that they just get overwhelmed.
Yeah.
And so when you're in society and you're working through society, and we've got this social rule book that doesn't exist, but everybody knows about, the rules change. And so sometimes autistic individuals struggle with that, where other people pick that up intuitively, if that makes sense.
Yes.
So when you're teaching a child or an individual, what you're doing is you need to teach them intellectually about the social rule book that changes based on the scenario. So if you think about it in that sense, it helps you kind of understand autism a little bit better.
Right. And so to your point about teaching them, teaching everyone about their environment. So what you decided to do is fill the gap of what was missing.
Correct.
As best as you could for parents in the healthcare realm. And part of that is St. Tammany Health System facilities, many of them are certified autism centers.
Yes.
And that doesn't mean that we are going to diagnose your child with autism.
Correct.
But we're going to define that in a minute. But you also offer resources and tools for parents to utilize before their child ever steps into one of our facilities. And that is important because of the sensory education.
Correct. So let's remember how I was just talking about how autism is a medical diagnosis.
Yes.
The medical community is not trained in autism. So what that means is that when I have a child that comes in that is maybe on the spectrum, we are more the screening process, okay?
Yeah.
And then we refer out for diagnostic evaluation, and then we refer out to the therapies, whether that's speech, OT, or the gold standard ABA. And so what I'm doing is with the St. Tammany Autism Initiative, I'm taking my medical provider hat, and then I'm also putting on my therapy hats, where they utilize tools to increase communication while decreasing anxiety. And so we use things like an AAC device, our visual supports, which is our stories, which is real life pictures. Of an example would be when someone walks into our doors from the waiting room to the nurse bringing them back, to the vital signs, to the physical exam, to when they leave and go to the parking lot. It gives them step by step, right? And so then we also have our video models, where it gives you a live version of that so they can hear the sounds. The best example I have of that one, which is probably one of my favorite ones, is one at the Bouton Joint Clinic, when you have a child that has a cast, and that cast is getting removed, and they remove it with this saw, and that saw looks something dangerous, right? It looks like something out of the garage, but it's not sharp. So what we do is we show the video, we concentrate on the sounds that they'll see, or hear, what they'll see there, and then what things we can do to decrease that anxiety. And then on the other side is we have the clinical tools. So if I have a nonverbal child, I can communicate via pictures, or we call it picture exchange system, somewhere along that line.
Right.
And we create it that is individualized to that clinic, so unique to that clinic.
And that's part of the certification. So the certification,
Mm-hmm.
let's delve just a little bit into that. What that does, and to correct me, you can correct me if I'm wrong, but from my understanding, is the certification has educated our clinical staff on how to interact with autistic children and adults.
Correct.
If you're treating adults.
Correct. So right now we have our CAC, so that's a Certified Autism Center.
Right.
And who gives that to us is, it's called the IBCCES, and that's a big, long, it's a mouthful, but it's the International Credentialing Continuing Education Standards, and it is an international certifying body. And what that means is, in order to get this designation, 80% of patient-facing staff has to be trained, and that training or that certification is every 2 years.
Mm-hmm.
And so what it does is, again, we are not, medical community is not trained in autism, but what it does is it gives them the introduction tools to be able to help that child come through.
Right.
And so I always think about, there's always two kids I think about from the top that I see in clinic. And there was one child that was banging his head, right? Just banging his head. And my first question is that something new to the parent usually? And if it's not, it still means I need to provide medical clearance for the reason why he's banging his head. So any person that's nonverbal will communicate via behavior. So the thing about it is how do I approach an exam, or how do I approach this child where he trusts me enough and feels safe enough, communicating, but he's nonverbal, and then do an exam on him where I have to use, my otoscope or an exam to decrease sensory input. And the best thing is to prepare him. So maybe he's banging his head because his ear hurts, and I give him medicine, and now the banging of the head goes away. So it's very important that we understand what autism is and the sensory components. And then when we go into the medical world, when you're coming into St. Tammany, we are initiating those steps to where we can give quality care for the whole person in that scenario.
So I want to just tell everyone right now that when you go to our website, sttammany.health, you can search autism, and the autism page will come up with these resources and information and videos on it. And we have some other things that we do, but I'm going to save that for our next guest in the clinics. So last topic that we're going to touch, because we just have a couple of minutes left. We talked about this. We've talked about this a lot. You and I have talked about it a lot, and our team has worked with your team, and it's been great. And one of the things we discovered by accident last time we were talking is that, really this is innovation. It's not a robot, right? It's not a groundbreaking surgery, but it is an innovative model. It is. That is really the first of its kind in the country.
It really is. So we will even get emails, or our certifying body will reach out to us and, what are y'all doing for this? What are you doing for that? Because at the end of the day, I can get a certification. I can have a stamp on the door, a sign on the door that says we're this. But if we're not implementing it, it doesn't mean anything. And a lot of times we have the directions, but we don't know how to do it. So you think about it, you're putting together a toy, at Christmas time, right? And you're reading the instructions. Well, half the time I'm like, I wish I can just Google and see a video of that, and it'll give me step by step. So sometimes the directions is not enough. So what we're doing is I'm taking the different hats from different disciplines and learning from others as well, and going, how do I make this better? And how can I show others how to make it better? So when patients do come in, they're not so scared. We also know that from a pediatric world, when they're transitioning into the adult, they're not going and seeking health care. They're stopping. That's not good, right? So what I'm trying to do is make it to where they feel safe, they feel heard, and they know that we're not going to put them in this box and assume what they can or can't do, or take their voice away, even if they're nonverbal, if you will. So I'm very proud of that, and it's I think it's growing, and I think we got some good things to come as well.
Well, I think so too.
Yeah.
And it's been wonderful to watch it evolve.
Yeah.
And so well, thank you for being here with us. You're a very busy woman with lots of energy that I wish I could borrow, but I can't. So, but thank you for coming, and thank you for sharing with us your story and your why, and talk about this groundbreaking initiative.
Thank you so much. I appreciate it.
So we're going to be right back with our next guest, so stay tuned.
It's never, if you build it, they will come. It's always, if the community needs it, we will build it. The new St. Tammany Health System Surgery Center doubles the number of operating rooms available, lessening wait times, speeding up recovery times. It's the most advanced center of its kind in the Gulf South. An investment in you.
So we're back with Healthy Living, and my second guest is Terry Johnson. Terry is the Director of Learning and Development for St. Tammany Health System, and she's heavily and actively involved with the St. Tammany Autism Initiative. So I wanted to bring her here today to talk about some things that we do within the health system and some resources we provide to parents. But first, I just want to welcome Terry. So welcome.
Thank you, Amy.
Thank
you for inviting me, and I appreciate that very much.
And thanks for being here. I know that your time is valuable, but I think this is time well spent. Tell people, can you tell people who are watching, who are you? What do you do for the health system? How long have you been there?
I have been at St. Tammany Health System for 18 years. I've been in my current role as the Director of Learning and Development for 7 years. So what I do is I make sure that everybody that we hire is ready to be trained and oriented to the 156 departments that we represent.
Wow.
And any annual competencies that are required by any of our governing boards that, you know, anoint hospitals to function.
Fun times.
It is. It's very technical, but it's education-based, continuing education,
and you
safety.
need to have that, yeah.
Absolutely.
But you do have a clinical background. You're a nurse.
Yes, I'm a nurse by trade, yes.
Yeah.
I've been a nurse for, oh gosh, I think 28 years now.
And you were Nurse of the Year a couple of years ago.
Yes.
Let's just tout that.
Yep.
Congratulations.
2 years
again
ago,
to
I was,
Terry.
yes. I was,
Nurse of the Year, very well deserved.
thank you, I appreciate that.
So we were talking with Sunny about World Autism Acceptance and really autism in general. And her personal connection grew, out of her personal connection grew this initiative that we do now, and it continues to grow. And we touched on certified autism centers and what that means. And then we also talked about what autism is and, you know, neurodiverse children with sensory needs, how we're trying to meet those needs, not only for the parent and the child, but also through our clinicians so that they can provide, you know, that care that is needed. And so for your part, you have a lot of involvement with this. So we have a bunch of tools on the table here, and we're going to show them up close in a little while. But what's your role in ensuring that these tools are available and accessible to parents and their families when they come into our clinics?
So I am a proud coordinator. I bring everyone from the pediatric service line, Dr. Sonny McDaniel, communications. I bring everybody that can help us make this real.
Yeah.
Together on a regular basis, we talk, we plan, we make sure our inventory is ready to go, and I keep it handy so I can replenish on as the need is. So, and then we plan for future initiatives and try to stay current.
Keep building on it.
We're trying. We're trying.
You're doing a good job. So we talked about the myriad resources that we have. We have all this online, the videos, and this and that. This is the resources personified, or a slice of them.
Correct.
So let's talk about this one real quick. This is our visual guide. Now, we're going to show you all this up close, but Sunny alluded to this. And this is for parents, right? When they come in, this is a visual guide for their child on what they might see or what they might, you know, need. And this is available online, but this is also in every certified autism clinic that we have, correct?
Correct.
And you'll notice that it's laminated, so it's easily cleanable. It's cleaned very frequently to prevent, you know, germs and things like that. But you mentioned something when we were talking before. It's available on the go. You're going out of town, your child has a health care need, or any kind of need really, pick up that, log on to our website and get that visual guide pulled up on your phone, and you can use it.
Correct. Go to sttammany.health/autism and bring these up on your cell phone, an iPad, any internet connected device, and you can click on Learn More, and this resource guide is on there for you to open up, and you can use it on demand if you're out of town. We also have a little one-page quick guide that comes so that we can very quickly assess your child's need, or even adult who's nonverbal. So, because a lot of our patients, you know, are nonverbal, or they might be scared and really can't talk, and this allows our staff to figure out what's going on with them.
Yeah.
You know, it empowers the patient, not just the parent, to communicate with us. So.
Yeah, so that's kind of like the question, the obvious question. is how does someone use this? And you know, you said it helps you to communicate. So what, in your mind, how does that work?
When you come in, and whether you're on the spectrum disorder or just have a deficit, we can just pull this out and say, can you tell me where it hurts? They can point, they can tell us where their needs are. We can do countdowns and go, okay, I need to measure you in 5, 4, and we can point and give you pointers, right? We can tell them that we're going to be taking their temperature on their forehead. We use a lot of forehead scanners, how we might have to check their pulse ox, you know, their oxygen level. So we can do a countdown, which gives them a little, you know, decreases anxiety and stress for the patient and their family, because it's very scary, as everybody knows, to go to the doctor, much less end up in an express care clinic or get admitted to the hospital or in the emergency room. It's very scary. It's overwhelming.
And so that feeds right into what Sunny was saying about education and preparation. So it's not like you're just all of a sudden doing something to an adult or a child. You have this tool to help them get prepared, and also the clinician to get prepared.
Correct.
So the certified autism centers, we talked about what they are. Why is this significant to our autistic population, that are children, but also adults?
I think the significance is that we are, because we are trained and we're certified, that we can meet you in the moment and where you're at and be ready to address your needs. We have these tools, so when you land here and you're scared, you know, you might be traveling down I-12 and you end up in our emergency room, and our staff have these tools available to them to help you and really individualize your care. Like Sunny said, everybody is different, so we have a variety of tools so that we can really get you to communicate what's going on, and so we can put you at ease and really treat you. So
yeah, and one of those things is when you come in, if you come into one of us, say our pediatric clinics, all of our pediatric clinics have this sensory bag.
Correct.
Okay, and this is not for every single child that walks through the door, because every single child who walks through the door doesn't need it.
Correct.
Right?
Right.
But if you have a child who is autistic or is neurodiverse and maybe nonverbal or has sensory issues, tell me about this bag. I know how this bag came about, and it was fun, right?
It was fun.
Really fun to build and create. And you really managed to bring it all together into one. You know, you identified what we would need and identified the needs of children and adults, and you came up with this. So tell me about it.
Sure. We had input from the communications team, from Sunny McDaniel. We looked and really talked about what should be in the bag. The bag needs to be for all age groups, so we needed to think about that. So, and kids need noise reduction. Sometimes they're sensory. The studio is very bright.
The light.
So light, and then depending on the age groups, I needed to be able to have a one-stop shop and anticipate a 3-year-old, 5-year-old, 17-year-old needing something. So they're adjustable. The sunglasses are kind of for smaller, but you know.
Yeah.
But we have different toys. So we have this is actually an oral toy for younger kids that would help.
In your mouth.
Right, and then we have different fidget toys depending on the age groups. There's more in the bag, there's more communication tools in the bag, and we actually give parents a copy of this guide and tell them how they can actually laminate and preserve it for themselves.
Amazing.
And we ask that they bring this to every single visit. Keep all these together in your little pack, and that way you're ready to, it's like a go bag if you have to seek out health care.
Yeah, because when we give them out, and we know, you know, who we give them to, and we ask you, like you said, to come back with them, because it's an investment. It's an investment, a worthwhile investment, and it's also something you're not just going to use in the clinic.
Right, it's something you can take everywhere. I love that it's striped, and so it's, if you have it on your kid's back, there's reflectors so cars can see you. So your kid has actually ownership also, and a partnership, because that's what we need. We need your kid to tell us what's wrong, and not, you know, a parent making an assumption, or, you know, we need everybody's input. So we want to give, you know, your kids some, you know, reduction in anxiety and stress, and let them know that it's okay to come to a healthcare provider in need.
That's right.
So,
and it's got Sully on the bag.
it does. There's
Original
our
Sully. So we're going to get an up close shot of this, but it's just it all is such an outstanding initiative. So these extra layers of education, the tools, how have they helped families from your view? Because I want to ask you about what families are saying to you, but I also want to see from your view, what kind of transformation have you seen?
I feel like our staff are confident to, you know, again, meet you, whether, you know, depending on where you enter, whether it's, you know, at a surprise visit to the ER or if it's a scheduled visit to our clinic. Our staff feel empowered to really take the time they need. They have the resources they need to give you that individualized care and really get a good visit and really make a difference in a kid's life. You know, Sonny has shared with me some kids, because they are so sensory overloaded, they can never really get a full head to toe till they're 4, 5, or 6.
Yeah.
So, you know, every child at every stop needs a full exam, and so you've got to be able to reduce their stress, or
Right.
you know, so that you can care for them. So that's one of the reasons we're doing this. Is
Yeah.
We're trying to make a difference. We're trying to make sure we're available for all the age groups, like you said, and you know, we have a lot of support. So
Good. And so now let's talk about what you've heard from the community. Have you gotten feedback from the community? And what has that been like?
It's been great, right? It validates what you do, so you always want to make sure what you're doing makes a difference.
Sure.
But sometimes you just assume you're making a difference. So I do ask, I do know who receives the bags, and I keep a log. And so I do ask them, you know, what item was best. I talk to the staff and say, what item did this, you know, the parent say was best for their child? What did you see the patient using? And so a lot of times it's the headphones, it's the fidget toys. They may have long waits, as you know, for test results.
Sure.
You may have to get admitted unexpectedly.
Right.
And if you know, hospitals are a 24/7, 365. There's lots of stimulations, beeps, noises, fresh staff coming in every 8 or 12 hours.
Right.
We've slept and we're ready to come take care of you. So that's a lot of stimulus. So that's what, you know, we hear from parents is, you're there, I needed it, I didn't anticipate being here, and I didn't have, you know, maybe they didn't have the noise
grab their
canceling.
little
Right.
bag.
I don't expect you to be prepared all the time. You know, the other thing is what we've seen is accidents, car accidents, and you can't get that go bag because your car, you know, that's not the thing you're worried about.
Sure.
So they've ended up in our ER, and we have supplies. So that's the other good thing is, you know, just because you have these doesn't mean they're always on, you know, available.
Right,
So.
exactly. And we've talked a lot about healthcare, and we do have our pediatric clinics are certified autism centers. Our bone and joint clinic
Correct.
is a certified autism center. Our pediatric ICU and pediatric peds unit
Correct.
in the hospital are certified, and our parenting center.
Yes.
So it's not just about, you know, healthcare and the clinical setting. It's also about play with other children and interacting with other children who are not necessarily neurodiverse or autistic, but you're in that situation. So there's a lot going on.
There is a lot going on. So
Yeah.
4 of the 5 certified centers are clinical, but we have 1 non-clinical spot, and that's the Parenting Center here in Covington. And they have kids 4 and under, and it's an inclusive play area. We have activities, and we make sure that everybody feels welcome. And we have modifications to our activities, our craft days, our birthday parties. We can actually tell parents, you know, if they have a lot of sensory issues, you know, come at these times. That tends to be our down times. We have videos that you can watch ahead. I've heard Sonny plug the videos. We have videos so that you can watch with your child before you get to the parenting center. We have flip charts so they can see what activities are there. So it's just an inclusive space. It's a safe space. It's a place where you can come talk to other parents that, you know, have maybe sensory diverse children.
Sure.
So it's just a great place to socialize and feel supported. And, you know, it's a great resource for parents. So.
And to that point where you say parents, I feel like it's augmented the purpose of the parenting center even further.
And
So.
again, the parenting center, we have a specialist who we have a dietitian who can help with food. We have somebody that has a master's in kinesiology. They're education based. We have a social worker. We're not a licensed center, but we can actually get you to resources and help you socialize and maybe give you some tips. So
That's awesome.
it's a great resource to have in our community. So very grateful for the hospital to have that.
Well, we're going to wrap up in a second, but I just wanted to give you the opportunity to add anything else you'd like to add.
Just grateful for all the support from the St. Tammany Health System Foundation, from the communications team, from Dr. Sonny McDaniel, Dr. McCall McDaniel, and their team, sharing their expertise with us, getting us started on the certification, helping us create these tools, giving us insight. I encourage parents to go to the sttammany.health website /autism, use those resources, start looking at them, look at the videos. We're here. We're trying to make a difference. So.
Yeah. Well, thank you so much,
No,
Sherry,
thank
for
you.
being here.
Appreciate it.
I appreciate it. And that is going to do it for this episode of Healthy Living. Everything we talked about you can find at sttammany.health. So please go and check it out, and we will see you next time on Healthy Living.